Imagine a moment where every second counts, where knowing what to do can be the difference between life and death. A heart attack is a serious medical emergency, but with the right knowledge, you can empower yourself and those around you to act swiftly and effectively. This guide is designed to equip you, the patient, with crucial information, turning fear into preparedness and uncertainty into decisive action. A heart attack, medically known as a myocardial infarction, occurs when the blood flow to a part of the heart muscle is severely reduced or blocked. This blockage is usually caused by a buildup of plaque, a fatty, waxy substance, in the arteries that supply blood to your heart. When this plaque ruptures, a blood clot forms, cutting off vital oxygen and nutrients. Without this essential blood flow, the affected heart muscle begins to die. This is why time is so critical. The longer the blockage persists, the more damage occurs to your heart. Understanding this process isn't just medical jargon, it's the foundation for appreciating why immediate action is paramount for your survival and recovery. This isn't just a statistic, it's about your heart, your future. Knowing the signs and what steps to take can significantly improve outcomes, minimizing damage and paving the way for a healthier life ahead. We want you to feel informed, not frightened, and ready to respond should this emergency ever arise. Your body often sends warning signals, and learning to interpret them is a powerful tool. Heart attack symptoms can be varied and sometimes subtle, making them easy to dismiss. However, recognizing these signs quickly is the first, most critical step in getting life-saving help. The most common symptom is chest pain or discomfort, but it's rarely like the dramatic chest clutching seen in movies. Instead, it often feels like pressure, squeezing, fullness, or a heavy ache in the center of your chest. You might describe it as an elephant sitting on your chest, or a tight band constricting you. This discomfort can last for more than a few minutes, or it might go away and come back. It's important to understand that this isn't always a sharp, stabbing pain. It can be a dull, persistent sensation that you might initially mistake for indigestion or heartburn. Don't ignore it, especially if it's new or unusual for you. Heart attack pain often doesn't stay confined to your chest. It can spread to other areas of your upper body, a phenomenon known as referred pain. This means the pain originates in your heart but is felt in other parts of your body due to shared nerve pathways. You might feel discomfort or pain in one or both arms, particularly the left arm. It can also radiate to your shoulders, neck, jaw, or even your back. Some people experience pain in their upper abdomen, which can be confusing and mistaken for stomach issues. Beyond pain, several other symptoms can signal a heart attack. Shortness of breath is common, often feeling like you can't get enough air, even when resting. You might feel winded, as if you've just run a marathon without moving. Sweating, often a cold sweat, can accompany other symptoms. Nausea or vomiting, sometimes described as a flu-like feeling, can also occur. Lightheadedness or dizziness, feeling faint, or even a sudden, unexplained weakness or profound fatigue are also important indicators. It's vital to understand that heart attack symptoms can differ significantly, especially in certain groups. Women, older adults, and people with diabetes often experience more subtle or atypical symptoms, which can unfortunately lead to delays in seeking care. Women, for instance, are more likely to experience shortness of breath, nausea/vomiting, back pain, jaw pain, or extreme fatigue without the classic crushing chest pain. They might describe it as a general malaise or discomfort rather than intense pain. These symptoms can be easily dismissed as stress or other less serious conditions. Older adults may also have less pronounced chest pain, or none at all. Their symptoms might manifest as sudden weakness, confusion, or fainting. People with diabetes, due to nerve damage, neuropathy, might not feel chest pain at all, experiencing only shortness of breath, fatigue, or nausea. This silent heart attack is particularly dangerous. If you belong to these groups, or if you have risk factors for heart disease, pay extra attention to any unusual or persistent symptoms. Trust your instincts. If something feels off, it's always better to get it checked out. Your awareness is your first line of defense. Once you suspect a heart attack, the single most important action you can take is to call for emergency medical help. This isn't a moment for hesitation or self-doubt. Immediately dialing 911, or your local emergency number, is a decision that can save your life and minimize long-term damage to your heart. The phrase "time is muscle" is a cornerstone of cardiology. It means that for every minute that passes without treatment during a heart attack, more heart muscle is deprived of oxygen and dies. This damage is irreversible, and can lead to serious complications, including heart failure. Prompt action ensures that you receive specialized medical care as quickly as possible. Emergency services are designed to respond rapidly, bringing critical care directly to you. Don't delay, even if you're unsure. It's always better to be safe than sorry. It might seem logical to drive yourself or have a family member drive you to the nearest hospital. However, this is a dangerous choice that can have severe consequences. During a heart attack, your condition can rapidly worsen. You could lose consciousness, making it impossible to drive safely and putting others at risk. An ambulance, on the other hand, is a mobile emergency room. It's staffed by highly trained emergency medical technicians, EMTs, and paramedics who can begin life-saving treatment the moment they arrive. They are equipped with defibrillators, oxygen, and medications that can stabilize your condition and even start to break up blood clots. When you call 911, treatment begins before you even reach the hospital. EMTs can perform an electrocardiogram, EKG, right in your home or on the way to the hospital. This EKG can be transmitted directly to the emergency room and the cardiac catheterization lab. This pre-arrival notification allows the hospital team to prepare for your specific needs, activating the cardiac team and ensuring that a catheterization lab is ready the moment you arrive. This seamless transition from ambulance to specialized care significantly reduces delays, which, as we've learned, is crucial for preserving heart muscle. While waiting for emergency medical services to arrive, there are a few critical steps you can take. These actions, guided by emergency personnel, can help stabilize your condition and potentially reduce the severity of the heart attack. Remember, always follow the advice of the 911 operator. It's incredibly difficult to stay calm during a medical emergency, but try your best. Panicking can increase your heart rate and blood pressure, putting more strain on your heart. Take slow, deep breaths if you can. When the EMTs arrive, clearly describe your symptoms, how long they've been occurring, and any relevant medical history or risk factors you have. This information is invaluable for them to quickly assess your situation and provide appropriate care. If you have a list of your medications, have it ready. If you have been previously diagnosed with a heart condition and prescribed nitroglycerin for chest pain, you may be advised by the 911 operator to take it. Nitroglycerin works by relaxing and widening your blood vessels, which can improve blood flow to your heart and ease chest pain. Follow the specific instructions given by your doctor regarding dosage and frequency. If the pain doesn't subside after taking the prescribed dose, or if it worsens, inform the emergency operator immediately. Never take someone else's nitroglycerin, as it can be dangerous if not prescribed for you. Aspirin can be a powerful tool during a heart attack, but it must be used correctly and only if advised by a healthcare professional or the 911 operator. Aspirin works by preventing blood platelets from clumping together, which can help to limit the growth of the blood clot blocking your artery. If advised, chew one non-enteric coated aspirin, typically 325 mg, or 481 mg baby aspirins. Chewing it allows for faster absorption into your bloodstream. Do not swallow it whole. It's crucial to confirm with 911 first, as aspirin may not be suitable if you have an aspirin allergy, a bleeding disorder, or are already taking blood thinners. If the person experiencing symptoms becomes unconscious and stops breathing normally, immediate CPR, cardiopulmonary resuscitation, is essential. CPR can keep blood flowing to the brain and other vital organs until professional help arrives. If you are untrained in CPR, perform hands-only CPR. This involves pushing hard and fast on the center of the chest, at a rate of about 100 to 120 compressions per minute. Think of the beat of the song "Stayin' Alive" to guide your rhythm. Continue until emergency personnel take over or an automated external defibrillator, AED, is available. If an AED is present, use it immediately. These devices are designed to be user-friendly, providing clear voice instructions on how to apply the pads and when to deliver a shock. Don't be afraid to use it, it can be a life-saving intervention. While waiting for emergency services, providing general care and comfort can make a significant difference to the person experiencing a heart attack. Your presence and calm demeanor can be incredibly reassuring. Help the person loosen any tight clothing around their neck, chest, or waist. This can include unbuttoning a shirt collar, loosening a tie, or unbuckling a belt. This simple step can help them breathe more easily and reduce feelings of constriction. Try to keep the person comfortable. Help them find a position that eases their breathing, often sitting upright or in a semi-reclined position. Ensure they are not too cold or too hot. If they are sweating, you might gently wipe their brow. If they feel chilly, a light blanket can be comforting. Your presence and calm reassurance are invaluable. Speak in a soothing voice, letting them know that help is on the way and that they are not alone. Avoid panicking yourself, as this can increase their anxiety. Stay with them constantly until emergency medical personnel arrive and take over. Your support can help reduce their stress and fear during a very frightening experience. Understanding heart attack symptoms and knowing what to do is not just information, it's a shield. We hope this guide empowers you to recognize the signs, act decisively, and potentially save a life, perhaps even your own. Don't wait for an emergency to learn these vital steps. Discuss heart attack symptoms with your family and friends. Learn hands-only CPR. If you have risk factors for heart disease, talk to your doctor about your personal risk and what preventive measures you can take. Your heart is precious. Protect it with knowledge and swift action. Share this information, commit it to memory, and be ready to respond. Your preparedness can make all the difference.